Hello and welcome to the Canadian Massage and Chiropractic Conference pre-conference broadcast series on One Concept Radio. I'm Felicia Brown and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing in Niagara Falls, Ontario, October 12th through 14th, 2012, and who are brought to you by One Concept. I'd like to take this opportunity to thank the 2012 Canadian Massage and Chiropractic Conference sponsors, the Vitality Depot, Lackner McClellan Insurance, New York Chiropractic College, the Registered Massage Therapist Association of Ontario, Massage Therapy Canada and Canadian Chiropractor magazines, Biotone, Massage Warehouse, Bon Vital, MPA Media, Family Massage Therapy, the DCCE, Performance Health, and Smile Dog Remote Reception Services for making this year's event possible. Our special guest today is Dr. Marshall Deltoff. Marshall and I will be talking about his class, Radiology. But before we get started, let me tell you a little about Marshall. Marshall Deltoff is a 1983 honors graduate of the Canadian Memorial Chiropractic College in Toronto. Subsequently, he completed his radiology residency at Los Angeles College of Chiropractic. Dr. Deltoff is a specialist in diagnostic imaging with over 25 years of academic and clinical experience. Dr. Deltoff has taught all aspects of undergraduate radiology at CMCC, where he also chaired the radiology residency program. He initiated and taught the radiology curriculum at the Université du Québec à Trois-Rivières, Canada's only university-based chiropractic program. Dr. Deltoff is the co-author of The Portable Skeletal X-Ray Library, a textbook of radiological bone diseases, several book chapters, and a number of professional manuscripts. In addition to his academic and clinical expertise, Dr. Deltoff is the immediate past president of the College of Chiropractors of Ontario, the regulatory body for over 4,000 doctors of chiropractic, where he served on council for 9 years as a member elected by his peers. Currently, Marshall maintains an X-ray consultation practice in Toronto and reads films for colleagues from across Canada. Marshall, welcome to the Canadian Massage and Chiropractic Conference pre-conference broadcast series. I so appreciate you making time to talk with me about the event and, of course, about your class, Radiology.
Thanks so much, Felicia. I'm really excited to be here today.
Wonderful. Well, we're so glad to have you. And before we discuss your class, Marshall, I'd like to hear your thoughts on why attending educational conferences and trade shows is so important to the success of all healing arts professionals.
Sure, Felicia. I think it's crucial. I really feel that attending continuing education seminars, whether it's a small local society meeting or a large state or national convention, offers an invaluable and irreplaceable opportunity for all 21st century healthcare practitioners for several reasons. First, of course, many states and provinces actually mandate compulsory CE hours for their registrants. Being able to meet and interact with the presenters both during and after the presentations can bring enhanced understanding of a particular concept or topic. And also, Felicia, we tend to become kind of isolated and insular in our own office and practice. So attending conferences gets you all in one place to meet old friends and classmates and meet new people and contacts. Also, checking out the trade shows exposes you to new products, up-to-date diagnostic and therapeutic technology, and ideas on how to modernize and streamline your office and how to run it. And finally, maybe most importantly, you can take advantage of the really palpable positive energy that permeates these events so you can recharge for Monday morning.
Those are all fantastic reasons. And, with this conference being in Niagara Falls, such a beautiful setting and with so much to do, in addition to the conference, there's something for everyone. So thanks for pointing out all of those reasons. I think everybody should be on the move for registering just from hearing that.
I would say bring your families also for a fun weekend.
Definitely. There's lots and lots to do in Niagara Falls. So I know I'm looking forward to enjoying some things outside of the conference and hotel. Now, Marshall, before we, or as we get into this discussion about your class on radiology, I'd like for you to explain exactly why did you choose to practice radiology versus having a general chiropractic practice?
Well, Felicia, I'm a very visual person. I've always loved art, drawing, and painting, but I also always enjoyed the biological sciences, so radiology really allows me to combine both of these loves into one discipline. I see taking and reading x-rays as a true art form, using a palette of black, white, and shades of gray to depict a person's condition and enable them to be diagnosed more accurately and treated more rapidly and properly. I also like the detective work involved in trying to image and interpret a three-dimensional structure with a two-dimensional medium. X-ray examination is arguably the second most important diagnostic tool for a chiropractor besides our hands. As a specialist, I really believe that my role is to support my colleagues and be a resource for them. My goal is to help other chiropractors more confidently and better treat the people in their communities. I also want to help them reduce their liability. So that's how I choose to contribute to my profession. I was the first Canadian to travel to the U.S. to attend a 3-year full-time radiology residency, which I completed at LACC in Los Angeles. I love radiology, and in almost 30 years of practice, I've taken and interpreted over 140,000 x-ray studies. Now I read x-rays from doctors from across Canada, films, CDs, and now even online. Some of the programs are now so technologically advanced, Felicia, that I can actually measure within a tenth of a millimeter on films.
Wow, those are some impressive numbers just from the technology and the number of films that you have actually gotten to interpret. And, being the first Canadian to be a part of that residency, it was just impressive.
Thanks. It was a big honor, and I take it as a big responsibility.
Well, it's clear that you really have a passion for radiology. I love the way that you talk about it as an art form and that you're having the opportunity to solve these puzzles. So it's clear that you enjoy performing the duties associated with being in radiology. But what do you enjoy most about teaching radiology?
Well, I really love teaching radiology, Felicia. Some aspects of radiology, such as, let's say, X-ray physics or biological effects of radiation, historically they can be kind of dry and tedious. And also, of course, discussing catastrophic diseases such as bone malignancies is never going to be particularly pleasant. So the challenge for me as an instructor is to generate interest and offer clinically relevant information in an inviting collegial format. Let's face it, X-ray is a source of anxiety for many practitioners as well as students. So I try to provide an enjoyable, interactive form in my presentations, regardless of the topic, so I can reduce stress. It's important for me that what I bring to my colleagues is thorough, well-organized, and visually stimulating. I really do want doctors to be able to go back to their offices on Monday morning with a greater confidence in reading films, writing proper reports, and knowing when to refer for a second opinion or consultation with a specialist such as myself. I hold by the maxim that there's no such thing as a stupid question. I'm really fortunate, Felicia. I've had phenomenal, even iconic teachers and mentors, among them recognizable names like Drs. Joe Howe, Terry Yoakum, and Lindsay Rowe, who all instilled in me a passion for both chiropractic and radiology. Radiology has provided me with the opportunity to fulfill several goals, such as writing a textbook and teaching at a university. I get to travel across North America, sharing my passion for diagnostic imaging to both undergraduate and postgraduate audiences. It's really enjoyable, with the best part, of course, being meeting so many colleagues and people who support chiropractic.
Well, it sounds like the class that you're going to be offering is going to be filled with information and practical tools for people to use when they get back into their practices after the conference. Can you tell me a little bit about what you have in store for the doctors at the conference in Niagara Falls?
Sure, Felicia. First of all, I really always consider it a privilege to speak to my colleagues, as they're paying good money and spending valuable time parking their rear in a chair facing my screen. I do respect that, so I'm naturally obliged to give them value. I'm going to start with an easy-to-apply, logical, and sequential approach to interpreting x-rays. So regardless of how dramatic or busy a radiograph appears, breaking things down systematically into proper, accepted, descriptive terminology, bit by bit, will make all x-ray reading more approachable. Then we're going to apply these principles to a wide variety of disease examples in a no-pressure, audience participation, fun, rounds-type format. And as time permits, I hope to cover some specific topics, for example, clinical and radiological clues that may indicate a child abuse case, and introducing the group to some new work that I'm doing in the area of increasing a patient's impairment rating through x-ray measurements. I really hope there's going to be something valuable for everyone.
Well, it definitely sounds intriguing. Personally, I'd never thought about radiology as a tool to determine abuse. So I find that fascinating.
Well, basically, it's one of the tools that can be used in terms of trying to correlate what a parent or caregiver comes in and giving a history versus what are the clinical and radiographic findings. So, for example, someone might come in and say, oh, my child fell off a swing or fell off a slide in the playground. But if the bruising pattern, the pain pattern, certain X-ray findings are not consistent with that, then you might have to look a little further and do some more investigation to see if it's really the facts.
Well, that's fascinating, and I think that'll be, along with the other things that you mentioned, really valuable information for those who attend your class. Now, I know you mentioned some issues such as bone malignancies when you were just speaking. Will you be discussing any of the other radiological bone diseases that are covered in your book?
Oh, absolutely, Felicia. I've really been privileged to amass over the years a collection of hundreds, maybe even thousands of X-ray cases, and they all depict common and uncommon conditions. So I'm definitely going to present a really good variety of cases from all the different categories of bone disease and some soft tissue conditions as well. Mm-hmm.
Excellent. Now, for people that are listening in and who are interested in getting additional education or training in radiology, or perhaps adding some facet of it to their practices, do you have any general suggestions for them?
Sure. There's a couple of things. First of all, if someone's really interested in getting additional training or education in radiology, first and foremost, there's a radiology full-time 3-year residencies. These are postgraduate programs, and they're held and offered at a number of chiropractic colleges in North America and abroad. So that's if you want to really become a chiropractic radiologist. Then you have to take a battery of exams put out by the American Chiropractic Board of Radiology, and then you're certified as a fellow of the college or a diplomate of the college. For the general practitioner, typically taking postgraduate courses at various conferences and seminars will help to keep them up to date and brushed up on their terminology, how to write a proper X-ray report, for example, using terminology that's accepted and legal and used by all different health disciplines. And then, of course, if you want to add X-ray to your practice, that's another issue. It's really a topic all to its own for another time, but certainly some of the considerations are, do you want an X-ray suite on site? Is it a cost-effective use of space, or are you better off using that space for treatment rooms? Are you going to use digital equipment or plain film? Then you have to start thinking about, do I want a dark room, and dealing with the chemistry and the plumbing and all of that. Or you can establish a relationship with a nearby fellow practitioner, a colleague who might have an X-ray machine, or even a nearby medical X-ray lab. And then you need to decide if you're going to read your own films or perhaps decrease your liability, as I mentioned earlier, by using the services of a specialist such as myself to write the reports for you. You may just want to do that for the more difficult cases or for the cases that involve medical legal situations where you want a documented expert opinion.
Well, those are a lot of different concerns that I wouldn't have even thought of in terms of adding X-ray, but I guess all of those are really important factors to consider. Like you said, the cost, what type of film that you're planning on using, digital or regular film, or maybe if it is it even a cost-effective idea to add into your practice. And I think those are really great considerations for people to take into account, to look and see, if they even really want to take on that responsibility. But certainly from what I'm hearing, even if they're going to be referring out that type of business, having a really solid working knowledge of radiology, both the technology that's involved as well as the terminology and the tools that are necessary, it's vital information for chiropractic practitioners.
That's absolutely right, Felicia. In fact, in various chiropractic college curriculum, we get more hours in X-ray taking and interpretation than the typical medical school. It is a very important diagnostic tool. I mean, you wouldn't necessarily want your electrician to go in and rewire a house without a blueprint. So in many instances, X-rays are important and give us information that we can't get any other way.
Fantastic. Any other information, Marshall, that you'd like to share with people coming to the conference or just about radiology in general?
Well, again, just to reiterate that X-ray is only one part of the whole diagnostic process. It's one tool, and it's a tool that I want to help my colleagues hone and feel comfortable and less anxious about because it is so important, and because, let's face it, radiation is a concern to people, and I always kind of quip that I want people to practice safe X, basically. And by that I mean you have to protect
That's very catchy.
You have to protect the person that's taking the x-rays, you have to protect the patient, and certainly you only want to take the minimum number of views. I've seen people come into my office with literally an envelope that's as thick as a phone book of all kinds of different angles and views, and you really don't need that. There are times when you need more than several views, but typically you want a minimum of 2 views at 90 degrees to each other because, as I said earlier, you're trying to picture a 3-dimensional structure in a 2-dimensional medium. So you try to take the minimum number of views and try to get the maximum amount of information because it is virtually like administering a type of poison or toxic substance, and you want to minimize that to get the proper diagnostic yield.
Well, I really like that phrase, practice safe X, and I think that could actually be a class title for you in the future, when you're talking about doing it safely and really minimizing exposure for all parties possible. So thanks for making me laugh. And, I think it's a vital topic, but I love the humor in that.
Well, it's a heavy topic, and so, as I said, I try to make things a little bit light. We're discussing some pretty serious stuff sometimes, and it's heavy. So, you want to make it usable information and stuff that the doctor can take back on Monday morning.
Well, and certainly memorable. So, tell me, Marshall, for people that want to get in touch with you before the conference or maybe who aren't going to be able to make it to the conference, how can they learn more about what you offer or just get more information about your classes or your practice?
Yeah, absolutely. I mean, I'm definitely happy to speak to anybody about any kind of issue, whether it's technical, equipment concerns or questions, or diagnostic film interpretation. I'm really here to help. So a good start would be my email address. I'm at marshdell, MARSHDEL, @yahoo.ca. I do have a website that lists some of the services that I offer to my colleagues, and that's www.drmarshalldeltoff.com. Or you're welcome to call me here in Toronto at 289-597-9333, and I really look forward to being of service to your listeners.
Well, thank you so much, Marshall. I'm sure that everyone listening is ready to come to the conference and register for your class, Radiology. Of course, I want to thank you again for taking the time to be with us today and for choosing to be a part of the 2012 Canadian Massage and Chiropractic Conference. We're really honored to have you at this year's event.
Well, thanks so much for having me, Felicia, on the program today. I'm really honored and privileged to be attending this inaugural conference here in Canada. I'd like to invite all of my Ontario colleagues to bring their families to the Canadian Massage and Chiropractic Conference in Niagara Falls in October for a weekend of fun, camaraderie, and clinically relevant information. I really look forward to meeting new friends and welcoming old classmates and students to this phenomenal social and educational event, Felicia.
Wonderful. Thank you again, Marshall. And now I want to just switch gears for a moment and make sure everyone listening knows how to be a part of this wonderful event. The Canadian Massage and Chiropractic Conference is one of the largest exhibitions of massage and chiropractic products, continuing education, and business opportunities for practitioners of both disciplines. The registration cost for the conference is just $68 and includes access to the trade hall floor for all 3 days, which houses, by the way, over 100 vendor booths and tables, access to all of the free 1-hour presentations for both chiropractic and massage, and 1 lunch voucher. Attendees may also choose to add workshops and full-day classes to their experience and participate in raffles and giveaways of literally thousands of dollars in prizes. On Sunday, October 14th, we're also offering free admission to registered students. Students will be greeted at 10 a.m. at our Smart from the Start seminar featuring top presenters in our industries. These presenters will be talking about the growth opportunities and struggles both industries may encounter. This is real-life education about what to expect after graduation and some topics that never get covered in school. All of this is happening at the beautiful Sheraton on the Falls Conference Center and Casino. Room rates are $139 to $179 a night, with up to 4 people to a room. But space is limited, so please make your reservations now. Also, Annex Publishing is printing the Canadian Massage and Chiropractic Conference event program inside Massage Therapy Canada and Canadian Chiropractor magazines. These will be given out at the conference and distributed throughout Canada to magazine subscribers. So if you are a vendor or educator who is listening in today and you'd like to get some great exposure for your class or product, please contact Christine Livingstone at Annex Publishing. Now, if you're ready to register for the 2012 Canadian Massage and Chiropractic Conference in Niagara Falls, and of course to meet Marshall, myself, and the other amazing instructors, there are now 2 ways to do so. First, you can register online and pick your courses instantly on the official conference websites, CanadianMassageConference.com and CanadianChiropracticConference.com, depending on your discipline. You may also register by phone. The call is free, and operators are waiting to speak with you at 877-681-5578. That's 877-681-5578. We also invite you to stay connected with us on Facebook at facebook.com/Canadian Massage Conference and /Canadian Chiropractic Conference. Again, the 2012 Canadian Massage and Chiropractic Conference is made possible by all of our wonderful sponsors. Thank you so much to the Vitality Depot, Lackner McClellan Insurance, New York Chiropractic College, the Registered Massage Therapists Association of Ontario, Massage Therapy Canada and Canadian Chiropractor magazines, Biotone, Massage Warehouse, Bon Vital, MPA Media, Family Massage Therapy, the DCCE, Performance Health, and Smile Dog Remote Reception Services. This is Felicia Brown, and on behalf of everyone from the Canadian Massage and Chiropractic Conference and One Concept Radio, I want to thank you for listening to this edition of the pre-conference broadcast series. Please remember to watch for more interviews between now and October 14th, and visit our websites and Facebook pages for replays of all the interviews in this series. We look forward to seeing you in Niagara Falls, Ontario in October. Please also consider joining us for the American Massage, Chiropractic, and Acupuncture Conferences, May 17th through 19th, 2003 in Atlanta, Georgia, and September 13th through 15th, 2003 in San Diego, California. Thanks again for tuning in, and have a fabulous day.